Practicing at the Qua Nutrition Clinics as one of the chief nutritionists, it's always important to understand that the human body can give you signals to its breakdown. Now, we do get a lot of clients with renal problems. Renal involves your kidneys and the urinary excretion system. Now, as a nutritionist, we know that you should lower your calcium or lower your phosphorus or increase your sodium or drop your sodium. Like, for example, we had this one case where we had a person with a lot of itchy skin, and we realized that it was a kidney problem because of too much of retention of phosphorus. Now, beyond a blood test, you can get into the gene world. When you do the entire genetic profile and do all the tests, the renal profile is one of them. In fact, some of the tests that are there, I even find it difficult to pronounce them medically, but the genetics goes through the entire gamut of seeing your risk potential. And what I like about the new gene report at Qua Nutrition Clinics is that, for example, like hypomagnesemia, which is low magnesium absorption. So your kidneys cannot reabsorb the magnesium back which you're taking in your diet, like say sunflower seeds, pumpkin seeds. So as a nutritionist, I'm like, oh, you need magnesium for headaches, you need magnesium for tight muscles, you need magnesium for softer potty. But what if your body is not absorbing the magnesium which I'm giving to you in extra diet in the form of sunflower seeds, pumpkin seeds, dark chocolate, or I'm giving you a magnesium bisglycinate or a magnesium citrate supplement? So when you know that there is a hypomagnesemia condition, then the understanding of why you have certain issues with your kidney could be there. And so we have this host of clinical analysis from a genetic point of view, which includes your chronic kidney disease, vesicouretic reflux, childhood nephrotic syndrome, hypomagnesia, hyperuricemia, focal segmental glomerulosclerosis, idiopathic membranous nephropathy, chronic glomerulonephritis, polycystic kidney disease, lupus nephritis, and renal calculi, and not to mention one of the most common most common ones where your autoimmune system actually attacks your kidneys. So how do you construct the diet for people with a renal problem? So there are two ways to approach this problem. One, you are doing a crystal gaze into your future, which is forecasting. So you're a young kid or you're a young adult and you have absolutely no problems, but you've seen that the people, the uncles or the fathers or the parents or something like that, somebody has had a kidney problem. Like, for example, I had a family which was chronic polycystic kidney, where a lot of cysts were there in the kidney. Now that's a genetic condition which she inherited from her great-grandfather. So where am I going with this? She did the test when she was 22 years old and knew she had it. So at a very young age, she began eating very disciplined. Kidney stones, for example. I once discovered a patient having chronic calcium oxalate kidney stones formation. And we solved the condition by improving the hyaluronic acid because there's a gene which encodes for a protein. I think it's called CDE44. And because we added hyaluronic acid, that holds back the calcium oxalate production. So to a certain extent, the genetic report will help you, one, alter your behavior, and that behavior will be altered from your diet and hydration perspective. And the diet can be reconstructed in terms of the sodium, potassium, calcium, phosphorus, as well as I did write the book Wheatless. And this book talks about how gluten sensitivity, wherein autoimmune disorders can be triggered because of your gluten and maybe even lactose or any other food sensitivity. So coupling the renal gene report with the nutrition gene report is a great way to get forecasting data to change the behavior of the client. So suddenly what happens is, instead of me saying it is the dietitian's diet that you need to follow, it is a bio-individualized diet that you're following, because at the end of the day, you kind of done your genetic test. And as I always say, your body is the most expensive real estate you'll ever own. So these tests are like architectural blueprints into if you have a leaking plumbing in some part of your house, you know how to deal with it or how to fix it.